Cardiovascular disease is the leading cause of death around the world. We routinely overwork, sleep too little, eat unhealthy foods, and do not exercise enough. We are frequently unaware that our bodies are communicating with us. Unfortunately, many people ignore or fail to recognize the warning signs in time. Heart problems can present in a variety of ways. The following is a list of 17 warning signals that could indicate a significant heart condition. If this is the case, you should see a doctor right away. Number 1. Tiredness. Fatigue can be caused by both heart disease and a lack of sleep. Because the amount of blood in the body is lowered during a cardiac arrest, the heart must work harder. As a result, one is fatigued both day and night. So, if you're continuously tired for no obvious reason, you should consult a doctor. Fatigue can sometimes be a symptom of a more serious condition. Number 2. Fainting. The incidence of frequent fainting is, without a doubt, rare. If you have recurrent problems with it, you should see a cardiologist immediately once, since it might be an indication of heart disease. Loss of consciousness can occur as a result of intense physical exercise, discomfort, or dehydration. There are several possible reasons, but it might potentially be a symptom of heart illness. This is commonly associated with a reduction in blood pressure, which results in a shortage of oxygen in the blood and, as a result, fainting. You should take it seriously and consult a doctor. Number 3. Gaining weight quickly. One of the symptoms of heart disease is fluid buildup in the body. As a result, swelling and flatulence ensue, and weight gain is noticeable. If you have this symptom, it is a good idea to keep note of what you consume on a daily basis. This is how you'll know if the increase is related to a diet change or not. Number 4. Nausea and appetite loss. Nausea, indigestion, and loss of appetite are all indicators of a heart disease risk. If this is a new problem, it is recommended to keep an eye on it and, if necessary, seek medical attention. Number 5. Heartbeat irregularity. A lot of things can contribute to palpitations. It's frequently brought on by a surge of adrenaline or a change in attitude. Anyone who observes their pulse becoming progressively erratic should seek quick medical assistance. An erratic heartbeat is known medically as arrhythmia. If left untreated, an arrhythmia can lead to a stroke. You should visit a doctor if you are having this symptom. Number 6. Persistent coughing. Coughing over a lengthy period of time might indicate cardiac problems. When the heart has trouble distributing blood to the rest of the body, some of it may end up in the lungs, resulting in a persistent cough. If you have a cough that generates sputum, you should be aware of the color of the sputum. Pink-white sputum is to be avoided at all costs. If your cough worsens when you lie down at night, it might be a sign of heart disease. Number 7. Cold sweat. Cold sweats are the body's way of sending a warning signal. Cold sweats, among other things, can indicate a cardiac condition, infection, cancer, or neurological disorder. Medication or stress can also trigger cold sweats. Number 8. Leg swelling. Swollen legs should be regarded seriously if they occur on a regular basis, as they may suggest cardiac issues. Edema is frequently caused by fluid retention. Because the legs and feet are the furthest away from the heart and the first place where blood flows, they are typically the most affected. If the swelling does not go away or worsens, you should see a doctor. Number 9. Sleeping disorder. Sleep disorders are frequently treatable and non-harmful. In many cases, however, a heart issue is to blame. As a consequence, taking insomnia seriously is crucial, since it may lead to a range of ailments. It is suggested that anyone who has difficulty falling or staying asleep visit a doctor. Breathing problems during sleeping may indicate a fluid accumulation in the lungs. Chest discomfort is a common cause of palpitations. Number 10. Gum inflammation. Many people aren't aware that dental and cardiovascular health are usually intertwined. It is vital to have your teeth checked on a regular basis, since oral health may affect the rest of your body. Number 11. Snoring. The majority of the time, you are unaware that you are snoring. Only those in your immediate surroundings are aware of it. Sleep apnea is the medical term for it. It's a fairly common occurrence these days. The heart beats briefly before returning to normal. Because individuals who are afflicted do not notice anything, it is necessary to keep vigilant and contact the doctor once too regularly rather than seldom. Number 12. Upper body and arm pain. The first thing that comes to mind when there is discomfort in the upper chest and arms is generally that there is tension. It might, however, be a sign of a heart attack. The misery of a heart attack does not begin at a predetermined moment. The pain usually radiates to the left, although it can sometimes radiate to the right arm, depending on the afflicted area. On a regular basis, you may have soreness in your mouth or back. Women are less likely than men to recognize the symptoms of a heart attack. Number 13. Breathing problems. Being out of breath might indicate a heart attack. If your airways and cardiovascular system aren't operating correctly together, it might be a sign of a cardiac issue that is either occurring or is going to occur. The lungs are deprived of air in this case, making breathing difficult. Number 14. Chest ache. Chest discomfort is a typical warning sign of heart disease or a heart attack. If the discomfort is accompanied by breathing issues, proceed with extreme caution. If the pain develops abruptly and without warning, it is best to go to the emergency room straight soon. There are distinct aches and pains. A feeling of tightness or a searing pain may occur. If your symptoms begin while you are resting and linger for a few minutes, you may be suffering from a heart attack. It is vital to get medical attention as soon as possible. Number 15. Ache in the toes. If you have toe pain when resting, you should figure out what's causing it. This might potentially be caused by aortoiliac occlusive disease. The best course of action is to consult with your doctor about your symptoms. Number 16. Erectile dysfunction. Low testosterone may be quite stressful for men. One of the causes of erectile dysfunction might be a heart problem. An erection requires an extra blood supply. When arteries become hardened, blood flow is interrupted. If you suffer from erectile dysfunction, it is vital that you get medical attention. Number 17. Migraine. Migraines might indicate the presence of heart issues. This sort of pain might indicate a stroke or a blood clot. If you're vomiting and dizzy in addition to the pain, there's no time to spare. Go to the emergency room straight away. In this circumstance, every second counts. Thank you for watching. If you liked this video, give it a big thumbs up and share it with your friends. And if you haven't subscribed yet, don't forget to hit that subscribe button and click the notifications bell to receive all our new videos. And be sure to check out our other videos.